And welcome to the chat on Newsday Amarillo and News Channel 10-2. I'm David Lovejoy.
And I'm Chuckalicious, Chuck Williams.
Joining us this morning is Dr. Rhonda Randall. Open enrollment season is upon us as we look ahead to 2024. Now is the time to assess your healthcare coverage options, to equip yourself and select a plan that will work best for your budget. As millions of Americans get ready to do this, a recent survey revealed that 1 in 3 people, 36%, spend less than 1 hour viewing their benefit options. You could be missing out on some coverage or some help you need. Dr. Randall, thank you for joining us this morning.
Thank you for having me.
Dr. Randall, I just have one question for you. Help! Listen, this is the time of year you're getting stuff in the mail. I'm looking at television, everything jumps up. You got to get enrolled. You got to get enrolled. Wait a minute. I got Medicare A and B. So make it seem like that doesn't help any. What do you advise a person to do?
Well, I think a lot of Americans are having the same experience that you are, right? It's the time of year where millions of Americans are choosing their healthcare coverage for next year. For about half of the country, they're getting their insurance through an employer-sponsored plan, and they generally have a 2-week period sometime between now and the end of the year. They're getting that information from their employer that it's time to choose their plan. And for Medicare beneficiaries, this is the time of year that you're getting a lot of information about your different options. That open enrollment period for Medicare starts on October the 15th and it will end on December the 7th. So the best advice really is to make sure that you're taking the time to consider your options. There's a lot of information out there, and cutting through it, we're here to help with some resources.
Let me ask you this, Doctor. Benefits, and sometimes this is where the shortcomings come in. People don't know what's covered, what they have access to. This includes things like mental health support, wellness program. Of course, during the pandemic, telehealth became a big part of how we handle healthcare in this country. What should we be looking for when it comes to the benefits and the perks of a plan, particular plan?
Well, you hit on some of the really important things that you'll want to consider. And it's why we don't want to be one of those people waiting to the last minute and only taking an hour to make the decision, right? You want to be thorough in what you're considering and what's important to you and your health, as well as your financial well-being, right? So I think the first thing is take the time to consider all those options. Learn the terminology. It can be really confusing. What's the difference between a premium and a deductible? What's the difference between a copay and a coinsurance? What are my upfront costs? What are my out-of-pocket costs? And there can be hidden things in there as well. Regardless, I'll tell you a couple tips I have. The first one is make sure that your personal doctor is in the plan that you're considering. That's really going to help you keep your costs down. The second is if you take prescription drugs, looking to see if the plan that you're considering covers the medication and ties back to your physician, right? Because they can be a great resource about your medications and the ones that are covered by the plan, and if there's another option for you.
You know, you say making sure your doctor's included in your plan. Let's say he's not, and I have to pick another doctor. My God, just picking another doctor and getting in to see him can be beyond the cutoff date. Aren't you penalized then?
It depends on the type of your plan, right? So some plans have out-of-network benefits, others do not. So really getting educated on that is important. How's that plan designed? If the plan has out-of-network coverage, you may or may not pay more. So that's something that you're going to need to look at as well. And staying with your primary care physician is really important for the continuity of your health. But if you do need to change, get a recommendation from your current physician.
Oh, okay. Whoa.
Doctor, that's one of the things when we talk about the cost of the budget, and we have some costs that for prescription medication can be outrageous. Do you have any tips specifically on how we can save money moving forward with a healthcare plan? What are some of the best policies moving forward when we're looking at saving the budget for healthcare?
Well, you mentioned one already. So many people would be surprised to know that original Medicare doesn't cover prescription drugs. You need a Part D
Hmm.
plan to cover prescription drugs, and most Medicare Advantage plans have integrated prescription drug plans. So that's something to look at, Medicare Advantage with Part D. Or a Medicare supplement plan with Part D are things that you're going to want to consider there. But other hidden costs could be things like specialty benefits. Dental, vision, and hearing might be included in your plan, and that can save you a lot of money,
Uh-huh.
as can wellness programs and access to something that you mentioned earlier, telehealth, whether it's for medical care or behavioral health care.
Doctor, we see it, like Chuck mentioned before, every 2 minutes there's a commercial and there's some
Hmm.
ex celebrity or something telling you you've got free money out there and this is this. What's the place that we need to go to find out information and get questions answered and not get sold? I think that's a lot of the problem.
Right.
People are selling product instead of trying to give people help. Where do we need to go? Where do we need to look for our resources on information?
We put all of these tips together on our website. It's uhcopenenrollment.com. Also, there you'll see linkages to some of those terms that we talked about earlier, a Just Plain Clear glossary and a Medicare Made Clear glossary that will really help you navigate your choice.
It worries me because we're so far down the alphabet as far as Medicare is concerned. I don't even know where to look. I mean, what are we on now? Medicare P or what?
Yeah, the different parts of Medicare can be confusing, right? Medicare Part A is covering things like hospitalizations. Part B is, for the most part, covering your physician visits.
Right.
Part C wraps it all together in a Medicare Advantage plan that might include additional benefits that are really nice perks. And Part D is the prescription drug plan. And then aside from all that, there are Medicare supplement plans. So you're right, it can be confusing,
Yes.
particularly if you're new to this. Having a caregiver who supports you that can walk you through it might be beneficial. Having a discussion with your primary care physician can help as well. And we've put everything on our website, uhcopenenrollment.com.
One last question for you, doctor. Is there still the possibility or the avenue that if someone doesn't pick a plan in a timely manner, are they still talking about the fines or the reprimands for not having coverage?
So for employer sponsored coverage, if you're getting your health care through your employer, generally what's going to happen is you're going to maintain the plan that you had last year, which may be fine for many people, but you might have missed out on something better for you. So you want to take the time to do that. For Medicare beneficiaries, there is a period of time that you need to sign up to get that coverage, or it can cost you more out of pocket in the future. So you're going to really want to pay attention to those dates, particularly for people who are turning 65 this year.
That's it. Once again, this segment is brought to you by United Healthcare. The good doctor here is the Chief Medical Officer of United Healthcare, employer and individual, the nation's largest business, serving the health coverage and well-being needs of nearly 28 Americans. This, like I said, you get inundated with everything from your mail to your inbox and email to television ads.
Right.
It can be confusing and you can cut through that. All you have to do is reach out and contact United Healthcare. They have a great website that will answer some basic questions for you and point you in the right direction so you get the coverage you need. There's nothing worse than having something happen in your life or some medical issue and then finding out you're not covered.
You're not
It's not
covered. Oh, yeah, that's a pistol. Big
and,
time.
and then you miss some benefits. There's things like a lot of people don't know there's behavioral health options, there's dental
Hmm.
options. There's a lot of different facets to it, and you need to go to a place that will answer your questions and not sell you something. United Healthcare will give you that platform. And like I said, October 15th is the kickoff date. I believe you said, Doctor, for sign up start around that time, right?
For Medicare beneficiaries, yes. And if you get your coverage through your employer, it may be sooner.
Sooner than that. All right. Well, Dr. Randall, thank you so much for spending time with us
Indeed.
today. And this is like I said, it is one of those things in our lives that we probably rely on. We know the least amount about, and that's our healthcare system. So appreciate your information and being here this morning.
Thank you. Be well.